Hi guys, welcome back to my channel. If you guys are new here, what's up? My name is Marissa and today I'm going to be showing you everything in my new clinical bag. This is an updated video. I did this video back in August or September, right before I started school, right before I even started clinical, and I showed you guys what was in my clinical bag of what school gave to us and basically everything in it. Now I'm going to show you what I actually use because I finished my first rotation. I'm now on to my third week of my second rotation. Picked up this bag last week because if you saw my last video, it was more like a purse style bag that they gave us. It had like our school name on it, everything like that. But with so much stuff, it was getting overfilled and I was bringing two bags and I just didn't want to have to do that anymore. So I was in the process of looking for a new backpack and I actually vlogged the day that I got this. That was my last video. And I saw this. It was on sale for 50% off. It's originally $100 and that's kind of expensive. It is a Vera Bradley bag, but it does have that like waterproof type material. But I was like, honestly, I was looking at it and I was like, this is such a cool bag. Like, it has so many compartments, which you'll see in a second. Not only for clinical, but once I graduate, this is going to be now like my work bag. A little overview. So this is basically what it looks like. It is, I think this is called the day bag, something like that. I'll have it linked down below if I can find it. It is patterned, so it is kind of floral. I'm not the biggest floral fan, but this kind of looks kind of like abstract floral, so like it's not the biggest deal to me. And I think that it's actually good that it's patterned on the inside, because if it was all black on the inside, you couldn't see the pockets and stuff. I'll just start in the big pocket just because I already have it open. But so it's one of those bags where you can pull this tight, so this, you can just pull it tight so no one gets like in it, and then you can flap it over and it's like looks like it's closed. It has two little pockets right here and right here. So in those little pockets I have my Memos Notepad. I just use it for writing vital signs, that type of stuff down. I also have sticky notes in case I forget that, or if I want to make a note on some clinical paperwork that I'm doing, or like someone's chart, like, okay, I need to remember to do this. I have some Vicks Vapor Rub. You know what this is for. Sometimes some smells can get a little intense and you just kind of put it underneath your nose and it blocks all the scents. Especially if you have a weak stomach, you never know, and you just want to give someone the most care that you can. So if that needs to happen, you can use it. Next in here is actually my full stethoscope case. So everything really fits in here pretty well. So I have my binder, two books, and this all in here, and I still have more space. So this is from Amazon. I can link it down below. And here is a lot of stuff. So I got this case because I have a Littmann stethoscope, so I want to keep it nice, and it's probably going to last the majority of my career. So I wanted to keep it nice, and also there is a ton of storage so I can also keep other things in here, just so they don't get all smushed and like lost in my bag. So I have my O2 sat, some goggles. I've never had to use these so far, but just in case that one day that I don't have them, I'm probably going to need them. Then I also obviously have my stethoscope. This is the seal blue color. I got it from Amazon, so I will link anything that I can find in here. I will link it down below just to be, so you guys can look at it as well. And then on the other side, so this is like padded and cushy because this is supposed to be for your stethoscope when you close it. In here I have bandage scissors, and then, which I need to get a new pair of bandage scissors because I was doing wound care the other day and it was like not cutting it. Literally not cutting it, and I just need to get better ones. And then I have a little measuring tape too, just to measure wounds to see if the size has gone down and stuff like that. So that's everything in here. Then I have two books. So this is the Nurse's Pocket Guide for diagnoses, interventions, what else? Rationales of why things you need to do interventions for different things. I just use this a lot for documentation. This is the F.A. Davis one. It came in like a package that we bought from our school, so always bringing this for all of my care plans and stuff like that. Then the holy grail, the drug guide. So this is just the Davis's one, and it has, this is the 16th edition. I think the 17th edition's already out, but yeah, this is for all of my meds whenever I'm passing meds, doing my med tracking sheets, all that good stuff. This, you will, once you get it, you will have it for a lifetime. There's so much information in here and it's really helpful. So I'll show you like a basic page. This is what a basic page looks like. So it basically gives you indication yeah, indications, actions, pharmacokinetics, like therapeutic use, pharmacologic use, adverse side effects, interactions, normal dosages, nursing assessments and implications, availability, potential nursing diagnosis to follow along with the drug. Very, very helpful. This in here is just my actual clinical binder. So this has all of my information in it. It has vitamin labs values in here. That's what I have right here, vitamin lab values, arterial blood gas values, and then also, oh, where's my clipboard? Oh, I was just using my clipboard for doing homework, but this is the clipboard that I use. I did use this in my other video as well. I didn't get a folding one because honestly, this does the job. I just set it down on like a side table or something and it's totally fine. So this actually would normally go in, there's like a, it's kind of like a laptop case bag, like pocket. So I usually put that in here just so I usually have loose papers, so I don't want it to get like all crumpled up, so I just kind of leave that in there. So that's everything in the big compartment, and then there is also more like zipper pockets. I haven't even used these yet. Also on the side pocket I have my big hand sanitizer and my pen light, just because I usually keep this in my side pocket, so I just threw that there last time after clinical. There's another pocket here. So this, honestly, I don't really use that much because I freaking forget that it's here. But I have this little pouch, it just says Massachusetts on it, and I have things in here like makeup wipes after sometimes I get really, really sweaty at clinical and I just want to like take off. I usually don't wear makeup, but if I do, I usually just try and take it off. I have snacks, some like feminine products, another hand sanitizer, more snacks, stuff like that in here. Going down to this one. So this has my blood pressure cuff in it. Sometimes we use the clinical site that we're using, sometimes we use our instructor, sometimes we borrow each other's. So I have all black pens, because you can only use black pens. Those are all my black pens. And then like I said, I have these alcohol little pads everywhere. And then this outside pocket, I have another snack, 2 little bottles. So I have another hand sanitizer, and then I also have a little lotion because my hands do get really dry from sanitizing and washing them so much. We need to hydrate a little bit. Sorry, that was kind of an abrupt stop to the video. My camera died. I actually did get everything in. So thank you guys so much for watching. I hope you enjoyed the video. I do post videos every Sunday at 10 a.m. So make sure to subscribe to stick around for more. If you have any questions about nursing school, about college, about transferring, literally anything, I now have my Instagram public, so you can just shoot me a DM on there. So that's that, and I will talk to you in my next video.